Are you in your 80s and your doctor's recommending a knee or hip replacement? Or do you have a loved one whose doctor is making recommendation for this type of surgery? Before you say yes, please watch this video. Hip replacements and knee replacements are big profit centers for hospitals. Why? Well, they can do a lot of them, and also it's very lucrative because Medicare pays lucratively for knee and hip replacements. But here's what you need to know. The doctor may tell you that once you have a new hip or a new knee, you're gonna feel young again. You're gonna feel like maybe you're 18 years old. But the truth is you won't. It's a very invasive surgery. There's a lot of rehab involved with it. Sometimes they don't go well. There can be infections in both the knee and the hip after this type of major surgery. Sometimes they're not put in properly, and therefore you have to go for revision surgery. I've had clients that have had to go 2, 3, 4, and 5 times to fix something that was done wrong in the first place. So before you agree to this surgery, you want to ask your doctor, how many of them have they done? What's the recuperation time? What happens if it's placed incorrectly and has to be revised? What happens if I get an infection? And decide whether this is worth it for you. Now, if you have a very debilitating, life-changing issue where you can't move anymore and you're confined to a wheelchair and a bed, that's a different situation. But as we get older, we may have aches and pains, and maybe our knees and hips don't work as well as they did before. But if it's not really impacting the quality of your life in a very significant way, ask yourself before you go into this surgery, is it worth it?